name's Rachel Jennings. I'd like to thank you for being here today. Today I'd like to talk to you about boo-boos and the do's and don'ts of how to care for them. When I say boo-boo, what I'm talking about is a minor cut or scrape. We've all probably had these happen to us, especially as children when you're out running around, maybe on a bicycle or skateboard, you've fallen off and injured yourself in some way. Maybe you're even like me, just simply walking down the street. An invisible object will trip you, causing you to fall and get scratches on your knees and elbows, hands, all that great stuff. So I'd like to talk today about what are some maybe old-fashioned ways for taking care of these minor scrapes, and what are the best ways to take care of them and why. It's important to give good wound care because we're trying to prevent infections from developing in these wounds. So when I'm talking about a wound or a minor wound, what am I really referring to here? Woundcarecenter.org title Different Types of Wounds describes a simple wound as something superficial. Basically, you're maybe getting that top layer of skin scraped off. There is no open or foreign object protruding from these wounds. Shouldn't have a whole lot of bleeding, shouldn't be an extreme amount of pain that lasts very long. They should not need any surgical intervention like sutures or staples to close the wound. And most definitely, you shouldn't have any deformity like an obvious broken bone, something like that. If you're experiencing any of those, you want to probably go to an emergency room. This isn't the kind of care that we want to be providing for these types of things. So if you do happen to have a minor wound, I'd like to first maybe start off talking about some of the outdated ways to take care of wounds. Some of the things I still hear today in the hospital setting that people might be doing, and discuss why those might not be the most beneficial. So we're going to start today talking about the don'ts, what not to do when caring for your wounds. The first one I'd like to talk about is actually leaving it open to air. A lot of people believe that if you just leave it exposed, it'll get a scab or whatnot on it and heal on its own. No intervention is needed. That's actually quite false. Not only are you leaving it open to air, which can actually dry out the cells at the area, which can delay in healing, but you have no protective barrier. You're just allowing bacteria and germs to be able to get into that wound and definitely cause an increase for infection, which we don't want. So leaving it open to air really shouldn't be your option to do. And then according to WebMD.com, title, You Should Bandage Your Cut or Sore, or Should You Leave It Open to Air, discusses alcohol and hydrogen peroxide. First one I'd like to talk about alcohol. When I think of putting alcohol on any cut or sore, I think, ouch, that hurts. As a child, I had this put on me by my grandmother once, and I still remember to this day how bad that hurt. In the nursing world, it's very common to walk into a patient's room and squirt a little hand sanitizer on your hands as you're going in to talk to the patient. And when you have a paper cut and do that, it's pretty excruciating. You do it once or twice and you remember to start staying away from that alcohol foam. So not only does it hurt, so you're not going to really want to put that on a wound because of the pain, but it also does more damage to the cells around the wound and can delay your healing process. When you've got a sore, you want to get that healed as quick as possible. It increases that chance of infection. Plus, if you have it on somewhere like a knee or an elbow, something you bend a lot, the longer it's there, the more you can reopen it and the more pain you get. So you want to stay away from alcohol. Hydrogen peroxide, that's probably one of the cooler of the ones. You put that on the wound and you get the little cool bubbles. Children usually like to kind of see that. Does the same thing as alcohol. Actually, it creates damage to the cells at the site and can delay healing. So we want to try to stay away from hydrogen peroxide as well. So leaving it open to air, alcohol, hydrogen peroxide, those are things you want to stay away from in caring for your wounds. So let's talk about some of the do's. What do we want to do when we're taking care of a wound? You've got MayoClinic.org titled Cuts and Scrapes. First aid and the proper steps. List these steps to take when taking care of a wound. If you have mild soap and water available, after you've examined and removed debris like little rocks or anything, you're going to want to clean the area. Get it as clean as you can. Up to 5 minutes is best, but sometimes it's hard to do, especially with little kids. So get it clean. If you are not somewhere where you have soap and water, Non-alcoholic pads like baby wipes are another great thing to use to clean that site, just to get those germs out of there. So these I keep with me in the car a lot for my kids. They're pretty easy to find, easy to travel with, so you can use these. Once you've cleaned the site, you're going to want to dry it with a clean cloth. Try not to use things that could leave debris behind, like Kleenexes, things like that, but a clean cloth to dry it. Then you're going to add a layer of protection with some triple antibiotic ointment. You can buy this at any over-the-counter pharmacy, Walmart, Gerbs. This helps to heal in make the healing process faster and also decrease your chance of infection. Then last but not least, you're going to want to cover the area. Most generally, a Band-Aid is going to work for this. You can get these, of course, anywhere as well. That you can find triple antibiotic ointment, but you want to put a Band-Aid on it, cover it, keep the chances of anything getting in there out as best you can. You're going to want to look at the site every day, continue to provide care if it needs it, clean it, add more antibiotic ointment, change out the Band-Aid. According to National Health Service, title, How Do I Clean a Wound?, explains some signs to watch for infection in case it is getting one. What are you looking for when you're checking these wounds out? Increased redness at the site, any increased warmth when you're touching it, it's hot, and especially any drainage. If you're noticing any drainage starting to come out of that wound, could be infected. You're going to want to see your healthcare provider. There are certain people who are at greater risk for infection from these minor wounds. According to Healthline.com, title Open Wounds describes people at a higher risk are those who have immune system complications. Maybe you're taking steroids for some reason, or you have an immunocompromised disease. HIV is one of them. Diabetics is another one. I see a lot in the hospital coming in with wounds that have gotten infected. And then the elderly population. Their skin elasticity is less and healing time is longer. So they're definitely at a greater risk for infection. So now that we know the do's and the don'ts of how to care for a wound, what I'm hoping today that you can take away again is just feeling more confident in how to provide care for these simple wounds and understanding why it's important. As a nurse in a hospital, I can tell you it's really sad when I see a patient come in and they're septic, they're really sick, and what has happened is they've had a minor cut or wound that didn't have proper care. They might be compromised again with their immune system, and it's gotten infected. And unfortunately, I've seen them need IV antibiotics. They're in the hospital for many days, takes them away from their families. Surgical intervention has even been needed. And in those extreme cases, I've actually seen amputations happen. So I'm not saying that because I want to scare you and make you think that every wound is going to lead to that. But I just want you, again, to take away that these simple steps in the beginning are so powerful in preventing the chance for infection. So if you have any questions, I'm be around after to answer any of those. And again, I'd like to thank you for being here.